everybody, welcome to a new video on my channel. So today it's a study with me video because I was thinking about doing this new format for the channel. Today I'm studying digestive pathology. It's my next exam. The people that are watching my vlogs know that I'm doing exams in this month. So first I have pediatrics, that I passed it. I'm so happy. Probably I will see this in the vlogs too, but I'm really happy about it. So now it's digestive and renal disease or pathology. So yes, I will be studying, we will be calm and studying. Probably I will be explaining some stuff like now in the beginning of the video, maybe in the middle I will be talking a bit. So for the people that just want to study, I will put the minutes where you can go in order to just watch me studying and study with me, okay? So let's begin. Today I'm studying trauma, abdominal trauma, and so yes, this is really important because as I'm seeing in this theme, we need to be careful with them. This is a life-threatening condition, and it's really important to have a fast and an adequate response. So let's begin. I normally study with my tablet because for me it's very comfortable. I have here lots of my notes. I have some of them that are on books or they are printed, but today I need the tablet. I like it because, as you can see, you can read very well. It's not as big as a laptop and as comfortable and it's not that uncomfortable. Sorry, you know that in fact English is not like my mother language, so for me sometimes it's difficult. But yeah, so this is for me very useful, the tablet, and then I have my notes. I like to write notes because it helps my brain to remember, and then the next day I just read the notes in order to remember what I wrote. So I try to do some part of passive learning, that is writing the notes, and some active learning, that is the next day remembering things and then reading them again. So let's move on. So now, for example, I have been reading a bit of the theme for the exam, so I am just watching some questions that we have to prepare the exam, because they are very similar to the exam's question. For example, this one is like a clinical case. This is a male, 30 years old, with an injury made with a like a soft weapon. You know, in this case, it's not a gun. You know, it means like a knife or something. And we can see that his blood pressure is like 70/40, so he's in hypotension. His cardiac frequency is like 130, which is really fast too. He's in Glasgow 14 too, so the veins in his neck are like flat, and the pulmonary auscultation is normal. So he says that you need to see if, like, this is like clinical cases, you know, that we have to prepare for exam. Other questions are related, like, what is the false, like, say the false in this case, say the one that is true. What are in this case, the characteristic of abdominal trauma? What is the ABCDE of the trauma urgencies, you know, like A is airways, and you have to see if the airways are like empty, or they have some kind of object, or they are, for example, like that they cannot breathe because they are like they have some kind of obstruction. Then we have also B, that is breath, and you have to see if the patient is breathing, if the thorax is like insufflating and then leaving there. And you also have to see the C, the circulation, if the blood is like going on its way and there is not any kind of hemorrhagia, like it's not bleeding the patient. Because in case they're bleeding, you really have to stop it, because it's really dangerous. When we have a trauma, they bleed very fast, and this causes them to really die from it. And you have to see if the bleeding is in the thorax here, it's abdominal, maybe it's in long bones, like for example here in the femur, or maybe it could be also like in the humerus too. And or if not, it's like sternum, no? Like for example, someone that has a limb shot, like cut, so they really need to you know, like have some kind of compression on the injury. You also need to see also if the brain is working properly, or if there is some kind of central problem. For this, you look at the pupils in the eyes, and you also have to see like Glasgow scale to see if how much is the level of the coma, if they are in a deep coma or not. And then you have to see the environment and prevent all the problems that can be caused by it, above all hypothermia, because hypothermia is really dangerous in people that have abdominal trauma. Well, in trauma in general, it's really dangerous when you have an urgency like this. Hypothermia, easy doses, and also it's really important to be careful with the coagulation. So these three parts of the trauma patient are really important, and you need to take care of them. So yes, I'm just reviewing some questions. If I find something interesting, I will be telling you soon. It's sometimes it's like, you know, it's really long studying and it can get a bit tiring. But I guess that all of you understand me too, because, you know, if you have studied sometimes, even if it is like a long time ago when you were a child or something, because now you're old and you're working or whatever, probably you know how it can be sometimes like tiring. I think it's tiring the same way as a job is, no? So I think this video is a bit short for like a study with me, but it's just a small video in order to see how you like this format. Probably you will have more videos of this that are even longer, and you just have to look them in my channel. I will like create some reproduction lists so you can like have them all together. And if you want to study for a long time, you can have like this one and the next one and the next one, just like keep in the video if you want to. For today I'm finishing with abdominal trauma, and even though I have to study more, I will not study at home, so that's why I will have to tell you goodbye for now, because for me it's a bit uncomfortable to bring my like camera and the tripod and everything to the library. So yeah, and or to my friend's house. It's better for me when I'm just alone. So that's why I have to say goodbye for now. This was a really interesting topic, the one related with abdominal trauma, because sometimes surgeries are with this, you know, and I kind of say that maybe are not like very often like a shotgun or something, or even a knife, but of course there are accidents, sadly, like car accidents and things like this, where you can find this abdominal trauma, and it's really important to be able to diagnose them, and above all to know if they need to be like classified in urgencies, like in urgencies, and you have to perform an urgency surgical procedure, or you can just like try to keep them and then the surgical procedure, because it's always better to have stabilize the patient and then to perform the surgical procedure. But sometimes this is not possible, because this is like a huge, this is an urgency that needs to be taken care as fast as it is possible. So I think that that's what this theme is trying to explain us, you know, like how you know how to diagnose this trauma, how to classify them, what kind of diagnose procedures you have to do, then what kind of treatment they will be under, and then yes, that's it. So I'm really happy to have you here, and see you soon in the next video. Bye! Bye bye!